Armrests can be adjusted in different ways. Some of them have a lever and then you just pull it right back. And when you put it back, make sure that the lever clicks. And then some of them can be taken out completely and even turned around. And this can help with transfers. And there are two different types of armrests. A desk armrest, which makes it easier for going in under a desk so it's not in the way, and then you can have a full-length armrest. There are two types of common seats. There's a sling seat and a rigid seat. The sling seat you can see is flexible, and the rigid seat is more durable but provides less comfort. If you wanted to make the seat more comfortable, because when someone is sitting in a sling seat, the weight drops to the center, you can add a cushion. Cushions can help prevent sores and irritation. However, when measuring the height, you're going to want to make sure you consider the patient sitting in, because the cushion will deflate a little bit. Two different types of back. You can have a sling back and a rigid back. A sling back makes it easier if you wanted to fold the chair, and a rigid back provides more comfort. Pelvic positioners can also be used to keep the patient in a steady place. They come in three different kinds: Velcro, some look like the strap of an airplane, and some look like car buckles. And they should be thought of as pelvic positioners, keeping the body in place, not as a seat belt. So the big wheels in the back are called the drive or push wheels, and they have two rims. The inner rim is the part of the tire that will actually be touching the ground, and they can come in two different kind of treads. One is smooth, and that's better for indoors, and then one has treads in it, and that's better for outdoor or multiple terrain. And the outer rim is what the patient will actually be using to propel the wheelchair themselves. And if they're having trouble with the angle or grabbing it, you can actually add projections onto the outer wheel to make it easier. The wheels come in two types. These are mag wheels, and they have 8 spokes usually coming from the center, and they're a harder plastic. They're actually made of magnesium. They're way more durable. And the old types of wheels are the steel wheels, and they have tons of spokes coming from the center, and they're just found on more standard wheelchairs. Wheel locks can be found on both wheels, and they're usually on both of the drive wheels. The way you lock them is there's a lever, and it'll be pushed forward, and you can feel kind of a stopping point, and you want to push it all the way. Wheel locks should be used whenever the patient is getting into or out of the wheelchair, and they should never be used as brakes. If the patient is having trouble pushing the wheel lock forward, there are extensions so you can increase the lever arm. The small wheels in the front are called caster wheels, and they come in two different kinds, just like the drive or push wheels. The standard kind is made out of rubber and is better for multi-terrain or uneven surfaces, and the pneumatic kind is filled with air, and they're better for shock absorption. The front rigging of every wheelchair can look very different. Some of them will have footrests, some of them might have calf pads, and some, like this one, will have heel loops that help keep the heel in place. And most of them will be removable, or at least you can slide them out to the side, which helps with making safer transfers. Anti-tipping devices can be found on the back of the wheelchair. Some of them can be removable, and some of them might not come with any anti-tipping devices. Most of them have wheels, or they're just a straight rod that come in contact with the ground when the wheelchair is tipped. But if you notice, it allows for some backwards movement of the wheels, and this helps get over bumps or obstacles in the way.